basically my whole agenda today is to really kind of give you an update on, like I said, the indirect side of things. So how can I simplify my cementation protocol? And it's just not cementation, it's what ceramics are out there. How do I know I'm picking the best ceramic in this day and age? Cements, am I using the right primers? Am I making sure that I've looked at strength and aesthetics? As well as talk to you a little bit about some of the top products in these categories at the end of this series. So when we're talking about ceramic selection, it's really important. Successful application of all ceramic materials really depend on the ability for the practitioner to select both, what meets the patient's aesthetic needs or functional needs, as well as a cementation protocol. And clinicians really need to understand that these materials and these systems, so that they can educate their patients and make sure that they're, using the appropriate protocols and treatment for their patients. In recent years, we've definitely seen an increase in the demand for all ceramic restorations to the point where they're almost becoming the standard of care. I mean, I don't know how many times I've had new patients come into the office, point to crowns with metal underneath, and they think that they're decaying, or they just, one of the questions that used to be about amalgam, now it's, I don't want those crowns with the metal base underneath them. So, and you know what, they're actually proven to be successful. So they provide excellent fit, function, and they meet the demands of many of our aesthetic cases. And with improvements that we see in manufacturing aesthetic qualities, demand for the actual all ceramic materials will continue to go up. I think it's important for clinicians to remain staying on top of the materials, because if you don't understand the base materials, like the glass ceramics and the oxide, it's going to be hard for you to understand how to treat these materials. So it's good to kind of just get that basic knowledge of what's making this material a little bit different. Okay, so we got a glass material, and now we're adding zirconia. And in your mind, that will make sense that, okay, you're getting a little bit higher flexural strength, or maybe I have to treat this differently. But just hinge on being careful with reviewing the indications, and as well as the patient considerations for a specific case.